Thank you for joining us today. This is Jennifer Feldman from Conant to hear how Gwinnett Medical Center deployed predictive analytics and vendor management technology to maximize the impact of a new patient accounting system. And we are also very pleased to have Cinnamon Kennard, Director of Patient Financial Services, and Travis Mendenhall, Manager of Patient Accounts from Gwinnett Medical Center. And Gwinnett is a nonprofit health system located in Georgia.
I'm Cinnamon Kennard. I'm the PFS Director here at Gwinnett. And just to give you a little bit of our stats, obviously you can read the screens, but we are known in Gwinnett County as Gwinnett Medical Center, and we have two primary campuses, one in Duluth and one in Lawrenceville. Our beds are 553, and just to kind of quantify our size, our ED visits typically stand out, and we have currently about 138,000 a year. And we are a trauma 2 level center, and we have everything from open heart to birthing to rehab to skilled nursing, just a whole variety of things. We did convert our patient accounting system, and it was much more than just the patient accounting system. It was our entire host system, our primary host, where our finances, charging, registration, billing, that conversion went from the Precision Alternative to STAR. Both of those are McKesson products. So you heard Steve talk about how we looked at our conversion as an opportunity to really envision how we would make changes. I think if anyone has been through a conversion, and just for the record, this was my first conversion. Travis, your?
My second one.
Travis's second. So we were really new at conversions here at Gwinnett. Our VP of Revenue had not been through one. Most of our supporting departments had not been through a conversion, and we had had TPA since 1986. So Gwinnett itself had not really experienced such a conversion. So when you look at the level of I guess fear associated with such a significant conversion, you start thinking of ways you can proactively improve processes. On our side, we were fearful of what does it look like with all of our business partners that impact cash flow, and how can we better manage that. So on the other side, we're also challenged with the self-pay population. And particular, I'm going to be talking about the self-pay and charity piece, and today you're going to hear Travis talk about the vendor management piece. So when we looked at the conversion, the opportunity for improvement using some Conant products, specifically for the presumptive charity piece, the PARO piece, we have an internal team of financial counseling. They're focused from when the patient is scheduled for a high dollar or comes into the ED and is admitted. They try to track those patients and get them to cooperate as best they can. If any of you are providers on the phone, you know how challenging that can be. Also, we try to see if they're eligible for any state funding or federal funding assistance programs. And again, it's based on their participation. If we don't succeed in that process, then it flows downhill to our external business partners, who then, handles those accounts internally themselves and goes, it's our bad debt. And it can take many years, and those accounts sit out there. So even if someone did qualify and we missed the opportunity to capture them and adjust that off, it's trickled all the way down. So some trends that were concerning for us, obviously, like everyone else, our self-pay volume had gone up. We did not get any additional FTEs in dealing with self-pay patients. Very difficult for patients to respond and cooperate with the needs of our financial assistance programs. Of course, the cash involved in our collection processes, and all this just, again, trickles down and just increases our bad debt.
This is Travis Mendenhall. I'm the Patient Accounts Manager, and I really want to speak to the vendor management portion of what Conant has helped us do. What we were facing, and I would like to clarify, when we're talking about self-pay, we're actually talking about true self-pay, financial class, as well as balance after insurance. So we're talking about collecting the patient portion. In our primary collection road, if you want to say, and that means, you know, trying to collect in-house, then sending to an early out vendor, then to a primary placement collection vendor, then to legal, and then to a tertiary collection agency. That's really what we're talking about putting onto a vendor management platform at this time. And I can speak more to that later. But what we were facing before our conversion is more than $186 million in cash flow each year in placements to these agencies. 4 different interfaces, and what I mean by interfaces is 4 different file exchanges, and then each of those file exchanges, each of those vendors or business partners getting a placement file, a transaction file, a recon file, and us getting close files back from them. So that turns 4 into 16 file exchanges. 4 different performance reports, all generated by the agency. So that's your agency telling you how they're performing, and you just taking them at their word, right? Not that they weren't honest, but still. A daily manual reconciliation task. You've always got to have someone assigned to look through spreadsheets and move accounts around, say, hey, this should be here, this should be here, where is this one now? Lots and back and forth of accounts between agencies and between the hospital and the agency. A lot of switching back and forth and just trying to figure out where things should be. Disparate levels of notes, if any, coming back from the agencies, and I'm not blaming our agencies for that. It's just that sometimes we had uploads of notes, and we couldn't handle the note volume that was coming in. So we would just say, well, just all we can take back is your canned notes. We can't handle all of your detailed notes, and that's really what you need to see when you're talking to a patient. Limited ability to do account level analysis and track policy compliance. I can't see into my vendor's system to see what's going on with an account. So wouldn't it be great to have an interface that would tell me what's going on in their system? You're really unable to truly compare vendor performance, apples to apples. Again, they're reporting their numbers to you, and you have no way to compare what's going on with a similar agency or even a potential agency for your business that might be outperforming your current agency. Or is your agency doing the best possible job in this hospital size and with this demographic? And then we're reviewing invoices by spot checking. Really just kind of, again, a lot of luck there.
Yeah. And so can I make a comment too, Travis? When we had 2 primary bad debt agencies that we split the alphabet with, and our initial experience in terms of reporting was, of course, they would report, but you could never compare because the reports were so different. So we asked for we gave them a report format and had them report that way, but it was still us just giving them the format and them giving us the information. So those were some of the opportunities that we had on the vendor management side. So the next slide goes more into more of our presumptive charity opportunity, and all of us are faced with the regulations from the federal government and, you know, meeting our obligations for the community benefit portion, you know, using the Form 990 to really share what we do and report accurately, which is a huge challenge in itself. And of course, we are a nonprofit, so anytime we look at these things, we're always at risk of potentially losing our status if we do things incorrectly, and that is such a huge risk factor for us. So obviously, before our conversion, we were not consistently and comprehensively looking at individuals the same before assigning them to bad debt. We did some manual processes. We immediately out of the gate, when the regulations started coming down about the treating everyone the same and not charging everyone the total charge on uninsured population. So we immediately took off a 10% off their total charge, regardless if they applied for charity or not. And that's really the most that we did at the time. So we were really trying to avoid any risk situation with losing our tax-exempt status. So we had clients do an assessment, and the assessment was great for us. They actually estimated that about $30 million of our bad debt, actually in bad debt already, should have been presumptive charity. So obviously we weren't getting FTEs. There was no way to handle this manually. We also liked the fact that they use not only the FPG scoring, but a socioeconomic scoring. And it's something that needed to happen in order to meet our community benefit requirements. And so we decided at that point we were going to put in a presumptive charity tool using their tool and go from there. Their assessment, which we'll get into a little bit, was pretty dead on target for us. So vendor management and presumptive charity, this piece really, this visual here kind of gives us an idea of the two products we implemented prior to the changeover to help us. The presumptive charity, like I mentioned before, we were at risk. We needed to do things differently, but we needed systems to do all that work for us and automatically adjust those things. And we'll see that in just a minute, what we actually put in place, our process, and where we timed it. The vendor management piece, as you heard Travis say, what was all the opportunities for us. Our biggest thing was, well, not the biggest thing, but the reconciliation process. Where was the account? The true transparency. Those things were all challenges. But when in terms of a conversion, we wanted to do it before because it helped us build what our process was and what our vendor or business partner flow was prior to the conversion, which helped us at go live. So we refined our policies and processes. It helped us eliminate some rework. The inventory, I will say that we were able to reconcile our inventory of accounts before we converted, which was really a godsend opportunity. And I think that was just a really gold nugget. I don't think we actually thought it through to that level, but when that happened, we were so thankful that it did. And then, of course, the reduced connectivity work for the new platform, the one vendor relationship, and the foundation of going forward for improvements. Do you have anything you want to add to that, Travis?
No, just because I've been on the front lines of the conversion, and just to clarify, we, instead of having to build all these file exchanges with 4 different agencies, we've dealt with one project manager to build all 4 of them. If we had integrated 8 agencies before go live, we could have dealt with one project manager for all 8, and I wish we'd done that. But it really clarifies things. You're not reinventing the wheel with each individual agency. Mm-hmm. Very nice.
Yeah. So the presumptive charity predictive analytics system, we chose PARO, and this gives a visual of really how this works and where we placed it. Again, if we could not capture someone at the time of their admission or immediately after discharge and could not get them to fully participate, then their account was still in a self-pay status. They would go through the scoring process, and then PARO would determine using, again, the socioeconomic and the FPG, and then the household ownership, the 3 different things they use. Then it automatically adjusts our account balance and brings it down to a 0 balance prior to going to bad debt. So immediately what we're now turning over to bad debt is accounts that really don't meet our charity guidelines, and so we're sending cleaner accounts downhill. But more importantly, we're reducing our bad debt and increasing our charity. And so you'll see those outcomes here in just a minute. But bottom line is, we're not sending charity accounts to our business partners and to giving them extra work and scrubbing these accounts.
Just to speak about what the vendor management technology platform solution is and what it's been able to do for us, the platform streamlines day-to-day operations. It increases visibility and control, the ability to automate our care tests and ensure integrity of patient communications. So just a little bit of how it works. Instead of your files going straight to, say, your primary placement vendor, it goes through Gwinnett and through Agency Manager, and there's actually a software platform that you can log into on the end user. The end user can log in and see where that account is. So Gwinnett actually places the account, and then all files go back and forth through there almost as a filter and a control so that you know where your accounts are at all times. So it's a single IT connection from our patient accounting system. It can handle virtually any vendor type. We currently have EBO, collection agencies, legal, but in the future we'll be adding an eligibility vendor, bankruptcy, probate, work comp, liens, all of those things. So we want to have everything eventually integrated. It's rule-driven, and we create the rules. So, for instance, on a placement to the EBO, we say that placement's 90 days. Well, at the end of that 90-day period, that account is automatically pulled back. Now, if there's a reason that the EBO would like to keep the account, they've set it up on a payment plan, they've changed that account handling status to a payment plan, or there's a dispute and they're holding it for a response to the dispute, they can say, hey, I want to hold this, and it goes into a work queue, and we can approve or deny that hold. So we're still in control of the account, but we know exactly where it is. So it handles account placement, recall, recon, and tracking. We automatically run a paracharity test on bad debt placements and package accounts for the next stage. And then through our file exchange, we can update our host system of where the account is as well. So you don't have to look in Gwinnett to where it is. You can look in your HIS system and see where your account is. And then there's a work queue system to manage handoffs and special requests. So I can go into a dispute work queue and work all the disputes. I can work all of the requests to keep an account longer and approve or deny those requests. And then there's comprehensive reporting on demand, including recoveries, agency activity, and exceptional issues.
But before, Travis, our work process and approving all those hands-off were email.
They were almost exclusively email.
Yeah. So you can imagine the manager, supervisor, team leads, it reduced their inbox.
Yep.
And consolidated all the
And that's not to say that we don't still email and phone and place phone calls, but we have a source of truth about where the account is, because you may have disagreement on balances or placement between your HIS system and the system that the agency's working out of. They may disagree, and then but the agency manager is going to tell you where that account should be. So some of the benefits we've realized: agencies have collected $7.8 million since January of 2013. Here's the big news. This is what was really exciting for me. and my staff who were working all of these recon issues, our inventory reconciliation account match rate, agency to Gwinnett, increased from 70% to 99% accuracy.
And that was before our implementation. We got that reconciled before the implementation.
Right.
Conversion.
We did an immediate, if you look at the next bullet, actually, we did an immediate, we found 179,000 discrepancy between Gwinnett and our one bad debt vendor, one. And so we were immediately able to increase that rate to 85% accuracy. And then since go live, we brought it up to 97% incrementally. So it's really amazing to see your recons sometimes out of sync by thousands of accounts, and then now to look at the reports today and see 4 or 5 accounts that are out of whack.
That dollar amount was due to contract variances in the systems, or what was that?
Really what it was is we were with one of our agencies for so long, and just over time, accounts 2, 3 at a time get lost. They just fall into a black hole. And over years and years and years, that black hole just gets bigger and bigger and bigger, and then you find it. Mm-hmm. And you move all those accounts along if you can, or you end up writing some off. But you know, our age inventory greater than 365 for our early out vendor decreased over 35%. So we found almost a third of those accounts, they were only supposed to have accounts for 90 days. And they had held on to a large inventory of accounts, and not necessarily that they knew they had. It's just that our recon was that bad with them. So all of those accounts got pushed downstream, which helps everyone downstream collect. And then we identified over 31 million as presumptive charity, and our charity increased by 34%.
Mm-hmm. And I'll just say their assessment was 30.7 million, I believe is what it was. So it was almost dead on what they estimated our presumptive charity would be at this point. So, or at this point, yeah. So pretty impressive.
And so our overall monthly collections are 30% higher than before the agency manager deployment. And I think there's really 2 reasons for that. You see our early out vendor hasn't really done much better, but they were the ones who were holding on to so many accounts. Well, we pushed all that downstream, and now everybody's keeping accounts as long as they should. And, you know, everyone has their skill set. You know, everyone has. That's the reason you're using all these different things and not just keeping everything in early out for 2 years. Is if early out doesn't work, your in-house collections don't work, you need a collection agency. If a collection agency doesn't work, you need a legal standpoint. If legal doesn't work, there are ways that a tertiary agency knows how to go out there and look for when someone's reemployed and collect. So getting them to the right place at the right time is really crucial to helping them do their jobs the way you have contracted them to do it. And it helps you also with your relationship with them, because you signed a contract saying you're going to get a placement at so many days. And then slowly over time that erodes. It just gets higher and higher and higher placement date. And this is bringing it back down to where it should be. So again, our early out inventory, if you look at it, they are now holding their accounts in that 90-day placement period as designed. And anything that falls outside of that is either on a payment plan or some sort of dispute. There are some folks who are applying for charity, and they've got a pending application, but it's such a small number of accounts, it's easy to go out there and take a look at it and see what they're holding on to. It's really incredible to have control. And then there's a lot of transparency about what your agencies are doing. You've got accurate on-demand reporting showing you that there is activity on your account. that it's not just going to that agency and they're scoring it low and saying, I'm not going to bother with this. I'll just hang on to it for the placement period and move it along whenever I'm done with it. You can see when the last call was made. You can see when the last letter was sent to the patient. And, of course, you can view active notes.
Okay, so the benefits of implementing our predictive charity tool had over 11,000 accounts worth $31.8 million qualify for presumptive charity. So we have reduced our bad debt by that number. We place that scoring right before our accounts go to our primary bad debt. So we are currently sending our uninsured patients through our early out process, letting them have an opportunity to try to collect. They close the account, then we are using the tool and adjusting it prior to bad debt. So pretty significant dollars, but again, right on line with what they said we would experience. Again, our charity care has increased from 34% in fiscal year 12 for us. We had 82 million, and in fiscal year 13, we ended our year with 110 million, and huge difference in terms of charity care, and then also this is a reduction of bad debt for us as well. So this is exactly what we wanted to see, and we wanted this process in place before the conversion. Anytime you convert to a patient accounting system, you want to start out as clean as you possibly can, so we feel great about that.
So just to recap a couple of the business office productivity improvements, a continuity of patient relationships. We deployed the technology on our legacy system to ensure the accounts get appropriate treatment, and so it's really seamless going forward into STAR. We ensure charity eligible accounts are not sent to collection agencies so that they don't have to spend their time scoring and getting rid of those accounts or wasting their energy on those accounts. Faster access to reports. I've got on-demand access to collection activity, and I can drill down to the account level. The aging of placements to an agent. Acknowledgement of file failures and number of accounts placed each week. I get emails every morning telling me if a particular file failed or how many accounts succeeded out of that file placement, and I can go in and look at failures. I'm sorry, let me back up. And then comprehensive performance comparison reports. So again, we can look and see what a comparable agency is performing like out there, one that we're not currently contracted with. It's blind, so we don't know what agency that is, but we can see what the competition's doing. Increased efficiency and tracking of responding to agency requests. We've got work queues that we can check daily to make sure we're responding to their needs, and then we can place requests in our work queues for them to reply to. Standardizing and simplification of the recon process. This is really one of the biggest things for us. And when we say move 2 FTEs doing recon down to 1 FTE, we don't mean they were doing that as a full-time job, but just about. But we do mean that we just had a serious increase in efficiency and having to deal with those recon issues on a daily basis. The identify and prevent issues related to files not sent to agencies. Again, we can see if one failed right away. And then visibility to underlying data issues. Previous transactions not consistent being accurately communicated between parties. So us being out of balance with the agency, we can tell if we're out of balance. We know if a transaction file failed, maybe we missed one. We can do a catch-up file and get everybody back on the same page. And then it also prevents 2 agencies from working accounts at the same time and trying to bill you for that.